The good health-related news is far fewer Americans are dying from heart attacks. The bad news is that's leading to people developing a host of other issues as they age.
Cone Health is one of the highest rated heart centers in the region, and they're finding and navigating the challenges of dealing with more and more people who just a generation ago wouldn't still be alive. The story of one of those people is the focus of tonight's Buckley Report.
I never dreamed I would be in the situation that I got in.
Gary Hunt is more than just a cautionary tale.
They said I was a walking miracle, so.
Because?
And I believe that. Well, I came in a dire situation. I think I'd been down, flatlined for 10 minutes.
In a previous generation, people didn't survive heart attacks.
Yeah, well, I had a little more than just a heart attack.
Left atrium, right atrium, so that
Indeed, he did.
the aortic valve is actually right here.
Gary collapsed at work and his heart was functioning at about 25%, but the doctors at Cone were able to save him.
I don't think I would have made it somewhere else.
The cause of death from heart disease has been reduced from maybe 41 to 24%, but there's also been a tenfold reduction in death from heart attack or myocardial infarction itself.
But as people survive heart attacks and live longer, the rest of life's wear and tear is taking a toll on us.
As you get older, you develop high blood pressure. That takes a toll on the heart. People develop diabetes. That takes a toll on the heart. We have a terrible obesity problem in the United States, which in and of itself creates a problem because, the abdominal fat turns out is like a plaque machine almost.
For Cone Health cardiologist Thomas Stuckey, heart health has very personal roots.
Did your mom's situation inspire you to go into this line of work?
My sister says yes. I don't remember it that way at all. I didn't even know what a cardiologist was when my mother died. She experienced some chest pain and then had a little event at home.
In 1966, Ann Stuckey spent 6 weeks convalescing in a hospital before finally coming home.
Yeah, she then collapsed and died suddenly.
But you must think about your mom when you save someone.
I think it's, it crosses my mind.
Lay flat on your back for me.
Gary is a prime example of how the development of medicines and procedures is keeping heart attacks from being fatal.
There's a tendency for people not to come in with a heart attack, but to come in with these more difficult, complex issues that are hard to solve.
More difficult to solve.
Yeah. Okay. Heart failure, people are often on 5, 6, 7 medications to keep them from being in the hospital.
Do you suspect we'll get our handle on that as we have these other things?
I think we're getting better at that because it's very expensive not to get better at that.
Are we eventually going to replace the heart altogether?
I think so.
How far off are we looking? A generation?
Well, that's been probably a 5-decade adventure.
You got the biggest version of that. So
In the meantime,
That's pretty amazing that they could put that through a catheter.
Yeah, I know.
the technology that helped save Gary's life is saving millions of others. Even though the U.S. population is, on average, more than 15% older than it was in 1990, deaths from heart disease are down more than 40%.
So this is blood flowing through the valve, the aortic valve, and I don't see any leaking backwards, so that's good.
And for Gary, so is life.
How do you feel today?
I feel good. Yep.
As well as you have in a few years?
Yep.
Bob Buckley, Fox 8 News.
And the doctor believes that the new technology will bring the cost of health care down more quickly than it will increase lifespans. But he believes in a few years they'll be able to do both.